to invite Dr. Sugaranjini ji for the paper presentation. Sugaranjini, I'm sorry.
Good morning. At the outset, I would like to thank everyone for giving me this opportunity. My paper is titled Looking Beyond the Schirmers Strip in Seronegative Sjögrens Syndrome. So according to the EULA criteria, a score of more than 4 is required to classify a patient as Sjögren's, with the maximum weightage being given to salivary gland biopsy and an anti-Ro antibody positivity. But 30% of these patients are negative for anti-Ro antibodies, and in them only a salivary gland biopsy, which is an invasive method, is the crucial for diagnosis of Sjögren's. So as ophthalmologists, can we find a non-invasive method to diagnose the Sjögren's syndrome? That was our aim, to assess the diagnostic ability of fluorescence-assisted examination of the lacrimal and the labial salivary gland in detecting Sjögren's syndrome amongst the seronegative suspects. So this was a prospective observational study in which all patients suspected to have clinically Sjögren's syndrome and who were anti-Ro antibody negative were referred from a rheumatology center for an ocular examination. The ophthalmologist was blinded at this point, and post the ophthalmic examination, patient was sent back to the rheumatologist for a salivary gland biopsy, and based on the salivary gland biopsy, the patient was determined as Sjögren's syndrome or negative Sjögren's. These were the ophthalmic examination parameters that we did. Apart from the normal dry eye parameters, we also looked at the lacrimal gland for the number of tear secreting points and the speed of the dilution of the dye by the tears, and also the number of salivary secreting points. Coming to our results, 59 patients suspected to have Sjögren's underwent a salivary gland biopsy, which confirmed the disease in 11, and 48 of them were negative. 48 of them were negative. All these patients were age matched, and more than 90% were females. And coming to the symptomatology, between the two groups, as we can see, majority of them did complain of dry eye and dry mouth. But though the mean OSDI was higher in the biopsy positive, there was no statistical difference. Same was true for the tear film height, where less than 0.22 is indicative of the disease. There was no significant difference. And in Schirmers test, where less than 5 is indicative of disease, there was no statistical significant difference between the two groups. Coming to the ocular surface staining score, where more than 5 is an indicative of the disease, there was no significant difference. And in the tear secreting points of the lacrimal gland, where the mean secreting points were 2.5 in the entire sample size, a decreased tear secreting points was not noted significantly different between the two groups. The only significant difference was the tear dilution speed, where the biopsy positive patients had a slow tear outflow rate compared to the biopsy negative patients. Coming to the labial salivary secreting points, where 14 was the mean, a decreased secreting points was not statistically significant between the two groups. So in our study, among the determinants of positive biopsy result, a slow tear flow rate showed a positive correlation with salivary gland biopsy positivity. Coming to the discussion, Kim et al. Pioneered the direct visualization of tear outflow from the lacrimal gland, and they brought about the quantification of tear secretion, and they noted a reduction in the tear secretion rate. This was further studied in detail by Singh et al. But they used a cumbersome methodology where they actually videotaped the entire salivary gland, lacrimal gland outflow, and they used a software to figure out the tear outflow rate. But this is a very cumbersome methodology which cannot be reproduced. So we adopted the rapid and slow tear secretion classification for reproducibility in clinical setting. Though this has been studied extensively, the correlation of this tear outflow rate with salivary gland biopsy is still lacking in literature. In the labial minor salivary gland secretion, in our cohort, we didn't see a significant difference between the two groups, and they were reduced in both the groups. And this could be because that the individuals were age matched, and this could be an age-related decline. So in our study of seronegative Sjögren's suspects, only the tear outflow rate was a positive determinant, and a slow tear outflow was most significant predictor of salivary gland biopsy. So the limitation of our study is a single center, small sample size, and the tears and saliva flow rate was not quantified. And in conclusion, a slow tear flow rate detected through fluorescence-assisted direct evaluation of lacrimal gland in Sjögren's syndrome suspects with a seronegative status should prompt a salivary gland biopsy to confirm the diagnosis of Sjögren's syndrome. Thank you so much for your patient listening.
Yeah, so I just want to ask you one question. Did it have any significant or a bearing in your management, the difference between the tear flow rate between the seronegative and seropositive?
Ma'am, we didn't take part in the treatment aspect of this. This was only for the study purpose. We only evaluated the patients. Uh, as a protocol, we just prescribed them tear substitutes. So for this particular study, we did not take part in the treatment aspect of the patient. So we just
So
studied
basically, most of the parameters, as you said, are similar, and
similar.
there is no practical difference in the symptomatology and management in
Correct,
between.
correct.
Thank you.
So what was the sample size which you had taken?
Ma'am, 59 were seronegative suspects. They were clinically suspected to have Sjögrens syndrome by the rheumatologist. And then they underwent salivary gland biopsy, out of which 11 of them were positive through salivary gland biopsy.
All right. So for salivary gland biopsy, you were sending them to the ENT department?
No, ma'am, the rheumatologists were performing it themselves,
All
yes.
right.
So we only did the ocular examination in a blinded way. We were not aware whether they were positive or negative. Only after our evaluation, they went back for the salivary gland biopsy.
I think that's all.
Yeah,